Right.
All right, good afternoon, everybody, and thank you for coming to our media briefing today. My name is Chris Cram. I'm the Director of Communications. I'll turn this over very quickly to our VIPs here today because time is short. We have with us Dr. Monifa B. McKnight, who is the Interim Superintendent for Montgomery County Public Schools, and we have Dr. James Bridgers, who is the Acting County Health Officer with the Department of Health and Human Services. We have some important information today about our commitment to remain open. Dr. McKnight, can you take the lead here, please?
Thank you so much, Chris, and good afternoon, and thank you all for coming together today. I call this press conference today to reiterate my intention to do everything in my power to keep our school system open for our students. I'm joined today by members of the MCPS Senior Leadership Team, Mr. Jimmy DeAndrea, Chief of Staff, Dr. Jeannie Dawson, Chief of Finance and Operations, Ms. Dana Edwards, Chief of District-Wide Services and Supports, and Ms. Rochelle Rubin, Chief of Teaching, Learning, and Schools. We're also fortunate to be joined today by Dr. James Bridgers, Acting Chief Health Officer from the Montgomery County Department of Health and Human Services. MCPS has partnered with DHHS through every step of this pandemic, and their recommendations have guided MCPS actions over the past 21 months, and we will continue to work in just that way. Our staff has worked incredibly hard this year to welcome students back to school for fully in-person instruction 5 days a week, because we absolutely know that face-to-face on-premises learning is how students learn best. That reality guided our pledge to fully reopen at the beginning of the school year. And it's why we're working around the clock to uphold that commitment. Fully reopening our schools has been a team effort. And I would like to thank all of our partners who've contributed to fostering a positive learning environment for our students this school year. First, our Board of Education has provided us with strong leadership during every single moment of this pandemic. And I appreciate that. Our county executive and his team have continued to stand by our side. And I've also spoken to Councilmember Craig Rice, Chairman of the Education and Culture Committee, and Council President Gabe Albornoz, who are in full support of doing everything we can as a community to keep our schools open. In addition, members of our 3 employee associations, the Montgomery County Educators Association, Service Employees International Union Local 500, as our partners, as well as our Montgomery County Association of Administrators and Principals, they have all remained at our students' sides every step of the way, from the moment they enter into our buildings in the morning, through day after day filled with teaching and learning, and all the way through the moment that they return to home, sometimes in the evening. So I want to thank our employees for all that they do to make sure we make this experience a positive one for our students. And then I also want to take an opportunity to thank the members of our MCPS COVID-19 Operations Advisory Team for their hard work so far this year. This group convenes representatives from our 3 employee associations, DHHS, as well as key community advocacy groups. And they've come together and we've brought them together because we know that our response grows much stronger when we leverage our community's collective IQ. So I want to thank every single member of this group for being a critical partner in our school system's fight against COVID-19. So I want to begin by saying we are well aware that our school system is currently facing an increase in COVID-19 cases, but this is just exactly what we're also seeing throughout many parts of Maryland, of the United States, and the world. And actually, indeed, within the past hour, we learned that Governor Hogan has tested positive for the virus, and we do wish him a full and speedy recovery. Now, our determination to keeping our school system open 5 days per week has not changed. It remains strong because that's what our students deserve. This is truly about all of us working to preserve the soul of public education. There is no plan to close all MCPS schools. Let me say that again. There is no plan to close all MCPS schools because I want to be very clear about that. To ensure the safety of students and staff, we will be following DHHS guidance around individual school outbreaks as defined by the Maryland Department of Health and the Maryland State Department of Education. Beginning when we return in January, we will operate under the following criteria. If 5% or more of unrelated students, teachers, and staff in a school test positive in a 14-day period with a minimum of 10 individuals testing positive, then DHHS and MCPS will work together to determine if that particular school should be closed for 14 days and students should transition to virtual learning. I want us to be very clear about that criteria and why it's really important for all of us to continue to work from a criteria. We don't want to get there. So while we are clear on the criteria, I also want to say we don't want to get there. Avoiding reaching the threshold that would trigger considerations for shifting to virtual learning at a school will be an all hands on deck opportunity. So that means that today I want to share some ways that parents, guardians, and community members can work together to make this happen. First, we need all members of our community to get vaccinated if they are eligible. I am very proud of the fact that more than 95% of our staff are vaccinated. Among our student populations, Montgomery County has one of the highest rates of vaccinations for adolescents aged 12 through 17 across the country. And since the vaccine was approved last month for students aged 5 to 11, more than 41,000 of our children ages 5 to 11 have already received at least one dose. We are continuing to forge ahead with these efforts. We are hosting ongoing vaccination clinics 7 days a week to further increase our numbers, and these clinics will absolutely continue in the new year. It is a privilege that our students go to school in Montgomery County, which is one of the highest vaccination rates in the entire country. But that is still not good enough. Our goal has to be 100%. And to get there, we need all members of our community to get vaccinated, not just our students and our staff. We also need members of our community to get the booster shot if they are eligible. It's one of the strongest tools we have at our disposal in this new fight against the new Omicron variant. Another way that we can help schools continue to be safe for students and staff is to participate in the COVID-19 screening testing. Screening testing already occurs in every school 1 day per week when a random sample of students whose parents have provided consent is tested. This strategy absolutely helps us slow COVID spread by identifying and isolating students who have COVID-19, but might not otherwise get tested because they aren't showing symptoms. When students return back to school in January, we will be increasing the amount of screening testing across our entire district. But it is not that simple, and that's why I'm calling on you today. Testing requires consent, and to date, under half of our families have agreed to participate in screening testing. We need a much larger number of families to participate in order to maximize the testing's effectiveness as a strategy to keep schools safe for our students and staff. And this becomes even more important when our students return in January. We need the families of all of our students to consent to having testing, both those who have received the vaccine and those who have not, because we are unfortunately seeing breakthrough cases in vaccinated individuals. We know that many of our students have received the vaccination since the school year began, and we celebrate that. If you have consented to get your child tested and your child later got vaccinated, that is great news. But please do not withdraw consent just because your child is vaccinated. Testing remains critical even after students are vaccinated. Like so much else with COVID, increasing participation in our testing program takes all of us. For our families, the form to consent is available at the top of our website. It is right there on the left side of the box that is titled COVID-19 information. You can also get a copy of the form at your child's school. So for our community members, I am calling on you to please use your platforms and resources to encourage all families to do this. I am asking you to talk to your neighbors, post on social media, send information on community listservs. Let's do whatever it takes to make sure we're getting these consent forms in. This effort to help keep schools safe and open is a community-wide endeavor, and I'm going to say it again, we need your help. If you are a business owner, please ask your customers if they have consented for their children in MCPS to participate in screening testing. You can also help by displaying a sign with a QR code on your doors, on your counters, wherever, so that families can easily consent on the spot if they haven't done so already. Links to download the sign are available at the top of the MCPS website. If you are a leader of a religious organization or a community group, please email your members and distribution list with a link to the consent form. When you are attending community events with families, please check in with one another to see if everyone has consented to participate in screening testing, and please encourage them to do so. I shared this example with you because our community is so strong in so many different ways. And we activate and do what's best all the time in the interest of our students. And now is our opportunity to do so. Now, while I'm also asking all of us to rest and enjoy during the winter break, this is the one piece of business that I really want us to be very serious about during this break. Business leaders, religious organization leaders, everyone in our community, if you can make sure you are asking the question, have you completed the consent form for your child to be tested when they come back into January? That's what we need to accomplish. And then I'll be more proud then to share how we have been able to increase the number of consent forms that we have based on your commitment. And so that's what I look forward to coming back and sharing, as I look forward to you helping us to do the work to make sure that as we increase testing in January for our students, we do not have barriers and roadblocks from allowing us to do that. We've taken your feedback as well. We're doing all the things to help make our form more easily accessible and easy for our parents to complete. I want to thank you in advance for all of the assistance that it is going to take in getting all of our families vaccinated and providing consent for our children to participate in screening testing and remain safe. So I'll now like to turn it over to Dr. Bridges and give him an opportunity to share some of the additional information that we thought was important to share with you today. Dr. Bridges?
Good afternoon, Dr. McKnight. Thank you for inviting me to join you on your press conference this afternoon. We've worked collaboratively for 22 months, and we will continue on that guide path. We are a resilient community, and we will keep our students safe. So having said that, I have a few slides just to share, just to briefly remind those who are joining us today about the importance of effectively and consistently wearing masks, and some points to consider regarding travel throughout this holiday season to protect not only themselves, but our students. And so as Dr. McKnight indicated, we want to get our folks vaccinated. We have the highest percentage of pediatric 5 to 11-year-old vaccinations in the state, and we are continuing to work with our MCPS partners to host clinics for those who are still eligible to receive vaccines and to make them fair and equitable. So we've been tracking this variant of concern called the Omicron variant, the B11529, and some of this information folks have seen, but I wanted to just remind folks that it is a variant of concern that is slowly taking over for Delta. It is highly transmissible, and studies are still being examined regarding breakthrough cases. In the county, our epidemiology team has run some preliminary analysis based on the data that we received from the state. And we know that the state data system has been down, but we've used alternative sources and means from hospitalization data to Johns Hopkins University to get data so that we can get a snapshot and an accurate picture to help inform our recommendations to MCPS. And we continue to do that. We continue to do our data analysis and our deeper dive and how the science applies to what we're doing and the recommendations that we are informing. But breakthrough cases are happening. Dr. McKnight indicated that Governor Hogan tested positive, as was reported this morning. So we want to keep folks safe. We want folks to be vaccinated, and we want folks to continue to be resilient, to wear masks correctly, and continue to monitor the signs along with us. And so wearing masks is one of the most effective ways to reduce the spread of earlier forms of the virus, Delta and Omicron. But we need folks to consistently and correctly wear masks, and that should be worn over their nose and covering their mouths. And there are pictures on CDC. We have pictures on our websites on how to correctly wear their masks. And parents, I ask that you and siblings of those children who are not eligible to wear masks model that behavior to correctly wear masks, especially when they're in settings of with those individuals who are not in their household or in indoor places, because as we protect ourselves, we want to protect our loved ones as well. If you're not fully vaccinated, you should continue to take those precautions to become vaccinated, especially in substantial and highly transmitted, transmissible areas. You can identify those spaces at CDC's website. We have information posted on the county's website, and continue to seek those places and implement those safeguards and protections. People fully vaccinated, indicated, should wear masks indoors, and we need to protect those who are not eligible to get vaccinated as well. Especially continue to do those things that we've prided ourselves over the past 22 months, those layered protective measures such as wearing masks, washing our hands, maintaining physical distance when space permits, and in those indoor settings. And if you're not fully vaccinated, you may want to reconsider that travel with you or your family, because you may be at greater risk, especially in those areas of high and substantial transmission. International travel requirements, as specified by CDC, indicate that you need to have a test before you return to the country, and you should continue to monitor your status. We ask, and we humbly employ students and parents who are returning to get a test before returning to school. CDC continues to recommend that all travelers get a COVID test 3 to 5 days after arrival, and those unvaccinated travelers should quarantine for 7 days after travel. These are practices that have been in place for almost 22 months now. And if you're not able to travel and if you have been exposed, please quarantine or isolate yourself, monitor your symptoms, and contact your primary care provider so that you won't put yourself, your family members, or your loved ones at risk. We will continue to update our websites and inform MCPS based on what the science and data are saying, so that we can ensure that our community is fully protected. And as Dr. McKnight indicated, our recommendations to MCPS, based on information provided by the Maryland Department of Health and the Centers for Disease Control and Prevention, are layered protective measures. In school, learning is paramount. We've witnessed that over the past 22 months, and we understand, and we will continue to provide the best practice to Dr. McKnight and our team. Thank you, Dr. McKnight, for allowing me to share some of these data, some of these data points, some of this information with our MCPS school community.
Thank you, Dr. Bridgers, and thank you, Dr. McKnight, for your comments. We'll now turn to questions from the media. If you would please use the electronic raise hand function to indicate that you want to ask a question, and I'll go in order. Does anybody wish to ask a question at this time? There was a hand up briefly from CBS News. Boss, did you wish to ask a question? Randy Bass, you have your hand up. WDVM, go ahead.
Hi, thanks so much for taking my question. I wanted to check in and see where things stand when it comes to test to stay. I know that there were some barriers either from the state or from within a staffing standpoint that was preventing that from happening. Where do things stand with that at this point?
Sure. Good afternoon, Randy, and great question, Dr. McKnight. I will respond to this one if you don't mind. So we continue to examine ways to increase our test to stay practice to keep more students in school. We didn't have any barriers from the state. We actually provided state with pilot data for its efficacy. CDC also released some additional information regarding the efficacy of Test to Stay. So we have increased our capacity, and we'll continue to increase our capacity to conduct Test to Stay measures in MCPS. We also had conversations with the Maryland Department of Health for additional resources. And so we're following up. We want to keep testing and increase our testing in our school systems. We know that we're able to identify those individuals who may be, who are asymptomatic but may test positive, but also those individuals who status is unknown. And so we will continue to increase and examine better practices to keep our students in school.
Okay, thank you, Dr. Bridgers. Those of you who don't know how to raise your hand, you can put a message in the chat and I'll call on you. Mr. Bonell, you had your hand up next from Bethesda Beat, I believe.
Yes, thank you. I want to go back to the metric the superintendent mentioned about if 5% or more of student staff or teachers test positive, there's the chance for closing that particular school. This could be for anyone. Can you just go in a little bit about how that number was kind of picked, kind of the reasoning behind that proposal?
So, Steve, great question. I'll respond to this question as well. The 5% classroom statewide outbreak definition was defined by the Maryland Department of Health. There are two definitions for classroom and school-wide outbreak definition. And so we have used and will continue to use the 5% of more unrelated student, teachers, and staff who have confirmed COVID-19 cases within a 14-day period or a minimum of 10 unrelated students. We haven't, students, teachers, and staff, we haven't reached that 5% as far as a school outbreak definition. And so these criteria were set by the Maryland Department of Health.
Is this, if that happens though, is it a default or is it case-by-case basis in terms of, you know, I just want to make sure, because I've been covering other things, you know, we hit a metric, it goes into place. What's the case here? Sure,
it's school based, and we have identified if in fact those schools, we've identified testing in collaboration with the Maryland Department of Health's epidemiology department, where we will go to those schools and we will conduct a mass testing. But it is school by school, and for those specific entities where they are set forth by the criteria of 5%.
And last question about kind of an update with the state site still being down with cases. Where does the local health department stand on kind of testing? I know I asked Sean about this the other day, but what holes are you still seeing when it comes to that in terms of, you know, you can do your own surveillance to the best of your ability, but what holes are still there since the state website is still down at this point?
So, Steve, again, great question. So we have access, and we are looking at the Essence database for hospitalizations. We don't see the level of hospitalizations in other regions. We have hospital data, and we don't have the death rates. There's still some holes, as you indicated. We're using our contracted labs in the county to assess our test positivity rate and case rate, but again, it's not representative of the county. It represents about 15 to 20%, as I'm sure Sean indicated in the presser last week. So we continue to look at data, looking at Johns Hopkins University data. And more importantly, we've had conversations with our labs just this morning to begin looking at a sampling of those cases for the Omicron variant, because we know it is highly transmissible and its virulence has yet to be determined as far as how it impacts individuals. And so these are some of the data challenges and assessments that we're doing with the available data that we have.
Thank you, everyone. Steve, we can come back to you if we have time. Donna St. George from the Washington Post has a question, and Randy, you have a follow-up. Let's go to Donna first, please.
Hi. I had a couple of questions about the 5% also. So, Dr. Bridgers, did you say that this has been in effect before now? This is not new? This is something that the health department or the State Department of Education has suggested in the past? And is it 5% or 10 unrelated?
So
case?
Donna, great question. These criteria have been in effect. These guidelines may be updated in January based on our conversations with the Maryland Department of Health and the health officers had on Friday as we collectively continue to assess potential impact on our school systems with the increase in Omicron variant. It is 5% or more of unrelated student, teachers, or staff, and it's a minimum of 10 unrelated student, teachers, or staff. And so we use a blended metrics in collaboration with our state and our internal communicable disease and epidemiology team to make those assessments to see whether or not it's the number or the percentage. And we haven't reached that 5% threshold as of this press conference in any of the schools to date.
And it's on a school basis, not a classroom basis. You're talking.
That's correct. That's correct. So there are two different criteria. There's a school outbreak criteria, and then there's a classroom criteria.
And okay, and if I could just ask one very related thing. So I've heard from many parents that that they feel the dashboard in the school system is not accurate and hasn't been updated well. How will parents be able to follow this 5% threshold and which schools are closed? Are you planning to do different things with the dashboard to make it more accurate or more up to date?
Good afternoon, Donna. This is Jimmy D'Andrea, Chief of Staff. So schools will continue to receive notifications from their school principals regarding cases at individual schools. We've been sending letters out since schools reopened last spring. The dashboard was an addition this fall and currently is updated on Wednesdays for the prior week. We are looking in January at the possibility of updating it more often, but schools will continue to receive those individual notifications from the school principals that provide the details on the number of cases on a regular basis.
Thank you. And thank you, Don. If we have time, we can come back. Randy, you had a follow-up question.
I did. Thank you. So my question is with the cyber attack at the Department of Health and everything, a lot of people are very confused, including myself. Is the data is still being collected regarding cases and deaths. It's just not being aggregated through the Department of Health. I'm not sure I'm totally clear what's going on from that standpoint.
Sure, Randy. Another great question. So the state system was hit with a cyber attack. They continue to collect the data, but it's the output of the information and data sharing that's been a challenge as they implement Safeguard. It's an aggregate data set as well, but getting it out to our local. And it wasn't every system. So we're still able to get vital records. We're still able to schedule clinics in PrepMod, get access data on immunization and those individuals. That's how we can continue to track and identify our vaccination strategies in Immunet. But there are some systems that feed into the state level system or even at the CDC. If you go to CDC's website, they haven't reported any data for us. We have low transmission and we're actually blue when I checked this morning. So that's the impact that we have. We can't do a deeper analysis. We have data. But again, as I indicated to Steve, that data that we receive from the state labs aren't representative of the county. It's a percentage, and we're using that as a basis of assumption to gauge. So over a week time, for example, if we know that on Monday we had 2%, and on Friday we have 7%, that's a significant increase, and there's a rise in community spread. We don't know whether or not it's still the Delta predominant variant strain or if it's the Omicron variant strain. And so we're working collaboratively with our labs to make more sequencing for the Omicron strand, but also to get a better data feed. And so this is what we've had to work with over the past 2 weeks. I don't have any indication when those systems are going online, but that's the information that we have this morning, or this afternoon, I should say.
Thank you, Dr. Bridgers. I think we have time for one, maybe two more questions. We have to be done about 12:35. I want to, go now to Fox, Stephanie Ramirez. First, Stephanie, you arrived late. That wasn't your fault. That's because you were in the waiting room under a name that we didn't recognize, but go ahead and ask your question.
Sure. Thank you, everybody. I'd like to ask a question that has been raised by parents concerned about some of the changes, including canceling extracurricular activities. Can you please, if you didn't already, and I apologize if you're repeating anything, but please explain to the parents why extracurricular activities were canceled due to the surge, but not sporting events over the winter period.
So, Stephanie, great question. I'll respond, and if anyone else from MCPS wants to join in, they can. But the original sports metrics that were set as far as the suspension and the recommendations that we made to MCPS was in collaboration with the Maryland Department of Health. Their epidemiology team intervened in providing guidance and set the recommendations that we shared and we supported and provided to MCPS. Again, we've made recommendations for a layered preventative strategy, which included identifying those high-risk activities. Basketball, we have data for that, unlike the extracurricular activity, which we are just begun to compile data. And there isn't a playbook, and so we are looking at the data and examining data and identifying best practices to mitigate any risk. And so while those extracurricular activities will still meet, we recognized and identified those higher risk areas that included instances where folks had higher exhalation or periods where they were singing or performing, et cetera. And so we included that extracurricular preventative measure. We also looked at the K through 12 test to stay, consistent and constant mask wearing, and weekly mask wearing as yet a third protective measure. And the final protective measure was the recommendation or consideration for in-person suspension, which is the means of last resort. And so we are assessing it on a daily basis. We noticed that some jurisdictions replicated some of our high-risk activity policies, recommendations, and or extracurricular activities, and have made some adjustments. And so we continue to make the recommendations based on the data that we have. As we have more data coming in about the extracurricular activity, we may make additional recommendations to either suspend as a whole, to return to some, or just particularly what those particular extracurricular activities would include. That's the current state of affairs that we are this afternoon. Our team is running an epidemiologic analysis this morning based on, again, additional data feeds. So that's kind of where we are, Stephanie.
And I also want to chime in on just that one. Stephanie, thank you for asking that question. As we continue to navigate the Omicron variant and anything else that come along with us navigating COVID-19 and the circumstances, we have to be diligent and look at every situation and make recommendations or make decisions based on that. So yes, we did start with extracurricular activities, but it doesn't mean that we're still not continuing to look at athletics and all of our programs as we continue to look at schools and their regular operation every single day. So that's the commitment that we do bring in our collaboration efforts from MCPS and DHHS, is to look at every situation and try to make the best decision based on the data that we have and the circumstances so that we can address it, so that it does not continue to impact spread in a way that compromises us in other areas. That's the focus of what we will continue to do. So I thank you for that question, because we're always talking about everything as it relates to our students and how we continue to keep safe spaces, but allow our students to continue to engage in education and in activities within MCPS. Chris?
Thank you, Dr. McKnight. Thank you, Dr. Bridgers. I know we had a hard stop here at 12:35. You both have other meetings to go to. So thank you all for coming and joining our media briefing today.